Cervical cancer is cancer that starts in the cell of the cervix. The cervix is the lower and narrow end of the uterus. The cervix connects the uterus to vagina. Through blood canal, the cervix cancer usually develops slowly over time. Before cancer appears in the cervix, the cell of the cervix go through changes known as dysplasia, in which abnormal cells begin to appear in the cervical tissue. Over time, if not destroyed or removed, the abnormal cell may become cancer cell and start to grow and spread more deeply into the cervix and to the surrounding area. There are two main parts of cervix: the ectocervix, the outer, and the endocervix, the inner parts. Types of cervical cancer: squamous cell carcinoma. Most cervical cancer, up to 90%, are squamous cell carcinoma. The cancer developed from the cell in the ectocervix, the outer parts. Adenocarcinoma. Cervical adenocarcinoma develop in the glandular cell of the endocortex. Clear cell adenocarcinoma, also called clear cell carcinoma or mesoneophroma, is a rare type of cervical adenocarcinoma. Symptom: many cervical cancer symptoms are also seen with other less serious conditions. These are the warning signs that should not be ignored. Causes: risk factor and prevention. Long-lasting HPV infection causes almost all cervical cancer. Then about HPV infection and other risk factor for cervical cancer and what you can do lower your risk. Screening: if you have a cervix, screening for cervical cancer is important part of routine health care. Diagnosis: learn about cervical cancer survival rates and how this statistic does not predict exactly what happened to you. Treatment: different phase cervical cancer can be treated.
Sign and symptom of cervical cancer: vaginal bleeding after sex, the most common sign. Vaginal bleeding after menopause. Vaginal bleeding between period or period that are heavier or longer than normal. Vaginal discharge that are watery and has a strong odor or that contain blood. Pelvic pain or pelvic pain during sexual intercourse. These are the main clinical signs of cervical cancer.